So, this is our third podcast, Abbey House Dental's third podcast. Me and you have been talking about doing this for a long time, so quite excited about today's one.
Yeah, we have.
So today we've got Dr. Nick Robson. Nick, tell us a little bit about how you joined Abbey House Dental, and a little bit about what made you get into root canal treatment and endodontics.
I joined Abbey House in 2022 on part of the endo team and started taking on the referrals for root canal treatment, saving teeth basically. And since then started offering sedation with root canals, which is amazing for anxious patients. And I got into root canal treatment quite early on in my career in FD when my training program director, Mark McAllister, he was amazing at just simplifying endo and make it easy to understand and also just easy to do in general practice when you're busy and you're trying to get it done quickly, but also effectively. And then a few years on, I decided to do another course, Karina Patel's course in endo expertise, and that was amazing, really practical, hands-on. And then I decided to go the full way for the masters at UCLan in Preston.
But just what made you, as dentists, most dentists that you are aware of, don't enjoy doing root canal treatment, and so we tend to try and refer to someone like you. What made you enjoy it, whereas a lot of us don't enjoy doing it?
I think I enjoy saving teeth, first of all, but it is a very fiddly thing. You're using very fine instruments, but I like that you can just follow a protocol, follow the steps, and then you can get a really good result.
Yeah, I mean, there's been so many cases where I've thought the tooth needs to come out, and I've had you look at it and you've saved the tooth, and obviously save the cost of having further treatment for that patient. So I think it's phenomenal what you do. What type of training do you need to do to be able to be in your position?
You need to do further training, either some kind of postgraduate diploma or ideally a master's, and that gives you the understanding and the skills to take on those more challenging cases. Like really curved canals can be challenging to get down. Very sclerosed or calcified canals can also be a real challenge and take a lot of time and patience. And then there's these more complicated things like when we're removing those fractured instruments, or there's an open apex. So you get those hands-on skills when you do an extra course, extra training. And
yeah, because I mean, during our undergraduate training as dentists, we're all trained to do root canal treatment. All of us are, and so when we qualify, we'll continue doing root canal treatments. What point do you think that this case should be referred to someone like you? Because there's a lot of root canal treatments that normal general dentists are doing. What type of cases do you think, hang on, that should be with someone who's had that extra training?
I think it can be any tooth really. Even an upper central can be a difficult tooth to root canal treat because it can have a very wide canal, and then you don't have a stop at the end for your GP, and you end up creating a lot of voids in there. Equally lower incisors, 40% of them have two canals, and to see that second canal can be really, really difficult, even with the microscope that we have here. And then a lot of molars, they've got three canals, and there was at least 40% of those will have a fourth canal, and this week I found one with 5 canals.
Wow, yeah.
So
I don't think I've ever found more than 3. So.
It can be really challenging to treat any tooth, but I think it's just assessing it really well beforehand, having that pre-operative x-ray, and assessing what might be difficult, and then anticipating that, and if you think it's just beyond your skill, then referring it on.
So you're kind of a support for us, isn't it, in terms of root canal and trying to save teeth. So I mean, I know at our practice we always try, and any tooth that we're thinking of removing, we always get one of you guys to have a look at it to see if it can be saved. So taking you back to kind of joining Abbey House Dental, you currently work in the Stoke practice, in Festival Park, you work in Stone as well, and future plans to work in Rugeley as well. I remember when you first came in, you had so much eagerness to kind of want to join, you approached us, didn't you?
Yeah.
And what made you approach Abbey House Dental? Why did you want to join the team here?
For me, it was a reputation of having a team that is very varied in their skill set, multidisciplinary, whether it's endodontics, restorative, implants, or perio. You have it all here. And that's really, really great to get second opinions on anything, and even endodontics needs that. We need to know the periodontal side and the restorative side to make sure that the prognosis for that tooth is going to be good for the patient. And having that expertise on hand, and then also primarily being able to sedate patients and learning that skill is so key, because so many patients are really nervous to have treatment.
Yeah, I mean, I was so excited to show you around and everything, and when we opened up the festival park, you were the first person I said, we need you there, Nick, because we need someone that can do these root canal treatments. But the support that kind of the practice gives some of the younger dentists is just unheard of, and I think we are also lucky to have some of the senior team members like yourself and the other consultants that work at our practice to help us. Going back to root canal treatments, so question that most patients ask is, why should I have root canal treatment instead of having my tooth out?
Your tooth is so important. You spent a lot of time growing that tooth. It's a very complex, kind of almost an organ. And your tooth stops the teeth either side moving. It helps you eat, helps you smile. And if you lose that tooth, then you're going to automatically have a gap. You could have that gap replaced, but whatever we replace it with is never going to be as good as that tooth. It's never going to have this ligament around it that can sense how hard you're biting. And so you could get an implant, but it's not going to feel the same. And that can be difficult to maintain. It's more difficult to clean in between the teeth. But your own tooth you've had that all your life, so you try and keep it wherever you can.
And toothache is the worst pain. Everyone describes it as the worst pain. I've had toothache, and a lot of our patients have a lot of toothache. And so when we're coming to you with such severe pain, we just want the pain to go. And so we have so many patients just to take it out, take the tooth out. Why do you think that is the wrong decision for a patient?
I think a lot of patients, when they're in that state of severe pain, obviously they just want the pain to stop as quickly as possible. And the first idea that comes to their head is just take it out. But if we can reassure them, maybe just numb the tooth first of all and say, look, you're out of pain. Now what decision do you want to make? Do you really want to lose that tooth? Because you can't get it back. You may be able to replace it, but it's always going to be a bit of a compromise.
So what can you do immediately then to get us out of pain? You kind of said we can numb you up. Is there anything else that we can kind of have done that will just get the pain to go?
Yeah, so we can numb you up completely, and then we can access the top part of the tooth, relieve the pressure in that tooth, and place a sedative dressing so that you can come back when you're not in pain and have the full root canal treatment done.
Brilliant, yeah. And kind of, you kind of mentioned implants, so me as an implantologist, I personally think that implants give you kind of the best long-term outcome. But having worked with you for so many years now, I have kind of changed my balance a little bit in that, if we can save a tooth and we can give it a good long-term prognosis, then we should always do that first. Even though the implant can give you a long-term treatment, it's the next step if you can't do it. I would never say to have a tooth removed to have an implant. It should be, can we save the tooth first? And if we can't, and the team say we can't save the tooth, then we place a dental implant. What are your thoughts on that, the kind of dilemma, dental implants versus root canal treatment?
I think absolutely there has to be a balance. We're not going to try and save teeth that are not going to have a good prognosis. They're not going to last more than a year. That's just not going to be worth it for most patients. But if you can save a tooth and it's going to give you that 10 years that 90% of root canal treated teeth can give you, then that's similar to an implant, isn't it?
Yeah.
And even if that tooth does end up going after about 10 years, then you still have the option to place that implant. But when that implant fails, then the only option you've got is to replace it with another implant, which I think is can be quite difficult.
Yeah, exactly. Yeah.
So I think it's just making sure that we can prolong the life of that specific tooth unit whether it's a root canal or an implant, so that the patient does have something to bite on there for as long as possible. And if we can push the implant down the road a bit, then I think that's all the better for the patient.
The standard of root canal treatments across kind of dentists varies a lot, doesn't it? And so we have so many patients that have had root canal treatments in the past that are infected again. A lot of the time, again, a lot of dentists will say just to remove that tooth. What could that tooth still be saved potentially?
Yeah, absolutely. We do a lot of root canal retreatments, redoing the root canal treatment, because sometimes there may be some bacteria that hasn't been cleaned out fully. There could be an extra canal that's very small that hasn't been seen. So we have the microscope to have a look for that. We have CBCT scanner, a 3D X-ray scan of the tooth to see where there may be an extra canal. And we have the skills to hopefully get past any blockages and give that tooth the best clean out and the best root canal treatment that we can.
I could see your face buzzing right now. We can all visualize it. You're doing it right now in your head. So that's really interesting. So I've had root canal treatment and it didn't work, and then I've come to you and I've had root canal treatment again, or I've had it twice now. Am I needing an implant now? Or is there another option?
Yeah, potentially root canal treatment can fail because we just simply can't access that part of the tooth from the top down, from the inside of the mouth. So another way is to do surgery on the tooth, which is where we will take back the gum and look directly at the root tip and remove the infection that way, and remove maybe a little bit of the root tip. Place a special sealant filling over that, and that can be really successful as well.
You really don't want me to place an implant, do you? You're doing everything you can to save the tooth. But no, that's amazing. In terms of root canals, again, there was a kind of very controversial documentary, which has now been banned, I think, from what I understand, called The Root Cause, and it our professionals kind of looked at by so many people in the public as to why we are doing root canal treatments and kind of risks involved in terms of the body. What is your stance on that? What do you...
I think that documentary centered on the logic that if you have a root canal treated tooth, it's a dead tooth. But the reality is it's got this ligament around it that's still very living, more living than an implant. And the thought back in the 1920s was that if there was any kind of bacteria left in the body, it could potentially cause an issue. But with the knowledge that we have today, the evidence that we have today, and the skills that we have to clean and disinfect teeth, we know that doesn't really have an impact. And by that same logic, you could say, well, if you take a tooth out, you're going to have a big wound there, a much bigger area for bacteria to get in and cause infection at that point. Whereas root canal, we can clean it, we can take an X-ray, we can check, and we can monitor it. And when patients come back and for their regular checkups, we just keep an eye on it. And if there is any infection there, if there is any inflammation growing, then we can rectify that then.
That's really interesting. There's another thing that I wanted to kind of talk to you about is we've referred quite a few cases to you where the tooth itself is not infected and it's fine, but there's not much left of the tooth. So we've asked you to do root canal treatment. Talk us a little bit as to why we do that and what that means.
So sometimes there can be decay that's very close to the nerve, or it's had a number of fillings in the past, or it could even just be trauma. It could be an accident to the tooth and the tooth's been hit. And sometimes teeth don't hurt that need root canal treatment. They may just have some inflammation on an X-ray, but it's important to treat that and disinfect it so it doesn't become a problem in the future. Otherwise you may get swelling, you may get an abscess. And we want to make sure that tooth lasts as long as possible, so that when you put a nice veneer or a crown on it, that is not going to cause you a problem in the future.
So effectively you're kind of building up the base to kind of make a tooth.
You're trying to make the foundations as good as possible, so it's going to last as long as possible.
Okay. And so when would I need root canal treatment? What are the signs that a person needs root canal treatment?
Pain is the obvious one, but like we said, it not always presents with pain first. It could be that there's a little swelling or even some pus coming out of the side of the gum. But that's why it's really important to come regularly and see the dentist for a checkup, because they can identify signs that you might not notice on your own tooth that needs root canal treatment.
Well, in my kind of days when I was doing less implants and more cosmetic dentistry, we used to have many teeth that would discolour after root canal treatment. And so we'd always have to think, when we're trying to do a smile makeover, we'd always have to think how we're going to kind of camouflage the look of that tooth. Why does that tooth go darker?
Usually teeth will darken prior to root canal treatment, where that nerve is kind of dying off, and all the blood vessels release kind of these byproducts that cause maybe the tooth to become more grey or sometimes more yellow. And a lot of the time during the root canal treatment we can actually clean that out, and it can get whiter as we finished it. And in some cases it may need some internal whitenings, where we put the whitening gel inside the tooth and it whitens from the inside out. And that can rectify many cases really, really well. And sometimes teeth can still darken after root canal treatment because there is no blood supply. It's changed the kind of translucency of the tooth. And in those cases we can put some filling material over it, or a veneer, maybe a crown, to mask that a bit better.
And so once you've done the root canal treatment, we generally are putting something more substantial over the tooth. Why is it that we have to put a crown or an onlay over most root treated teeth? What's the reason for that?
Most root treated teeth have had big fillings, so that in itself might mean that we need to put a crown on. But then in addition we have to make space to go inside the tooth, so we're taking away quite a lot of tooth structure, and that weakens the tooth. But we have the option to put a crown or an onlay on the tooth, and that really strengthens it. It holds the tooth all together, because you do have less nerve in the tooth. There's only the ligament feeling the pressure that you put on it, and that can increase the amount of pressure that you do put on it, even though it may be less than, say, an implant.
So is it always necessary then to have the crown?
In the vast majority of cases for back teeth, it's probably recommended to have a crown. On front teeth though, a lot of the time the access into the tooth is a lot smaller, and the filling may be smaller that you've had. So sometimes it's just a filling in the back of the tooth that you may not even see.
So talking about percentages then, so what do you think, based on kind of the latest research, what do you think is the success rate of having root canal treatment on average?
Generally, on a good tooth with good bone levels, it's not too broken down, you can get about 90% 10 years survival, which is pretty much equivalent to an implant. So.
And then if I was having root canal treatment a second time, what would be the success rates of that?
That can drop to about 75-80%. It can vary quite significantly depending on what caused the root canal treatment to fail. But you can still get really good results with that.
I would add on top of that is that you need someone who's super qualified at this. I think if you're having it done again a second time, you need to have someone that's been doing this a long time with the right equipment. Talking about the equipment and the technology, what specific technology do you use at Abbey House Dental that makes you do better root canal treatments than the average dentist?
One of the biggest factors for success of root canal treatment is using a microscope to be able to find all the canals. They're really fine, some of them maybe as fine as a hair, and just with your eyes you can't really see that, and the microscope can go up to 23 times magnification.
Wow.
So we can really see all the kind of cracks in there, all the canals, and the light is straight down, so there's no shadow there. We can see so much more with that, and it just makes doing root canals more fun. The posture's better, you're not bending over the patient. So that's really, really key. But also 3D scans, the CBCT, that can be key to seeing what we can't see on an x-ray, and maybe what we can't even work out from seeing on a microscope. Sometimes the canal can be so calcified that you can be drilling in the right place, but you just can't find it. And sometimes you need that confidence with the CBCT, the scan, to go that little bit further, or maybe a little bit to the side to find that canal. So those two things are probably the main equipment that really help root canal treatment.
So, Abbey House is well known for treating very anxious patients, and generally speaking, a lot of patients that are quite scared only come when they've got toothache. What can you do to kind of relax them in terms of, relaxing the patient and kind of letting them have root canal treatment? Because we know root canal treatment appointments are quite long on average, and so it's not a quick treatment. Is there anything that you offer that we can kind of relax the patient with?
Yeah, one of the best things we offer at Abbey House for anxious patients is IV sedation. So it's an injection in your arm, and it makes you quite sleepy, quite drowsy, and many patients won't even remember the treatment after. And a lot of patients will have maybe a couple of sessions of sedation, and then they feel a lot more confident, and they don't even need sedation following that. But it really builds their confidence to just get in the practice, because they know they're not going to be anxious, they're not really going to be aware of the treatment they're having. So that works amazing.
Talking about the future, with AI being kind of everywhere in our lives, and where do you think the future of root canal treatment is going? What's the future technology, and where do you think AI will come into that, or has it already come in?
I think AI has helped in analyze x-rays. It's helped as a kind of adjunct to certain parts of dentistry, but I don't think it will ever replace like a dentist or any like key specific part of our role. But it will help us in terms of maybe treatment planning, or writing our notes, or analysing our CBCTs or radiographs. I think the future is just streamlining and making more efficient the workflow and giving the patient the best treatment they can get.
Yeah, okay. And so we obviously are referring to you, and we know that a lot of external dental practices are referring to you as well. How easy is it to refer your cases to you?
Yeah, it's really easy. Just go onto the Abbey House Dental website, and there's a referral form. Then you can just fill in your details, the patient details, send us an x-ray, and then we'll pick that up. As soon as we contact the patient, we'll send you an email, let you know that we've contacted them, and then when they book in, we'll let you know again. When we see them for their consultation, you get a full report about what we found in the consultation and the treatment plan going ahead. And then when we've done that treatment, another report will go to you, and often we will review the patient ourselves, check that the treatment has been successful, and let you know if there's any issues. And
as a patient, if I wanted to I know I need root canal treatment, can I just directly come to you for a consultation? Yeah, so you can either come into the practice, or you can register online. There's a consultation booking form there, so you can pick your specific day, or you can just give us a call. And talking about yourself now, where do you see yourself in 5 years down the line in terms of your training and your future aspirations?
I think for me, the next step is getting more confident with endodontic surgery. So doing that microsurgery with the microscope, doing those apicectomies, maybe root resections, also collaborating with more of the team, like the perio team, and doing those more complex cases that require multidisciplinary.
Okay. So I think that's the end. Was there anything else, Nick, you wanted to discuss on this podcast? I'm looking forward to the next one.
Yeah,
Thank you for having you.
Thank you for having me.